Hello, everyone. Welcome to Health Talk. I'm Evelyn. Hatfield and Vicki's off today. Over the past several months, we've been talking about substance use in the Prince William community. And today we plan to continue our discussion, particularly on opioid dependency. But before we start that, I would like to put a plug in for an upcoming program that we will talk a little bit more at the end of the show. And that is a program that's scheduled for June 8th. It's called Chasing the Dragon. It will be held at Forest Park High School. And it's to actually, they plan to have a panel discussion with experts on the topic. And there will be information and resources available. So I think Dr. Ansher will be talking more about that as the show goes on. So first of all, I'd like to thank you all for coming today. I have to my left is Dr. Allison Ansher. She is with the Prince William Health Department. And then also next to her is Dr. Bobby Maglani, who is with the Community Services Board, Mental Health Center. So as I mentioned, thank you all so much for coming today. We've been talking about substance use for a long time, and opiates have been out there. Also, abuse and addiction has been there. Why now? What's going on now, Dr. Maglani?
Well, Evelyn, first of all, let me thank you for inviting me, inviting Dr. Ansher, and highlighting, I think, this critical issue for the citizens of this county. And to answer your question, I think we're talking about it now because this is a storm of perfect proportions.
Okay.
Like you said, opioid abuse has been out there for millennia. I think in more recent times, it's gone from an urban disease, which was focused with heroin import, returning veterans in the 60s and 70s, to now an all-pervasive, all-consuming disease, which is prevalent in every strata, every socioeconomic and demographic section of our society, and it's taking a toll. Just based on the 2015 data that we have for our county, there were over 200 deaths caused by this issue. So the best remedy we have at this point is to highlight what's going on and to educate the consumers, the public, and hopefully reach our decision makers to have better tools to address this.
Okay, so basically what you're saying is it affects almost any group. No specific group, culture, or do I have that right?
Well, in medicine, we have a great tradition of trying to silo out illnesses so we can understand them better. We think if we can define it, then we can maybe define it and confine it. We can address it better. But this is one that's gotten away. It's prevalent in every race, class, demographic, and it cuts across all lines. And, it involves us as healthcare providers and, with our citizens paying the price.
Okay.
I think it's time we pull all these resources together to address it.
Okay. Dr. Ansher, so I take it this is a public health issue. So can you tell us a little bit more about that?
The State Health Commissioner, Dr. Levine, determined it was a public health emergency. And the reason she did that was to allow some relaxation on some prescribing. Naloxone reverses the effects of opioid overdose in an effort to prevent somebody from dying from an overdose. And by declaring a public health emergency, anybody can go to a pharmacy without a prescription and is able to request naloxone. The pharmacist does educate the individual, unless the individual's been educated before on how to use it. The purpose helps refer them for services if it's actually the individual who has a substance abuse issue.
Okay.
Additionally, we're seeing an increase in hepatitis C and B, secondary to, it's been associated with now the use of heroin, IV drug abuse,
Okay.
has dramatically risen. In Wisconsin, there was an HIV, rise in HIV cases that were associated with a particular community from sharing needles. And when they instituted a clean needle exchange program, it brought the incidence way down.
Okay, so you did see some decline in that.
In Wisconsin.
Okay, okay.
Recently.
I think it might have been Indiana.
I apologize. You're right. Indiana.
Okay.
Yeah, Indiana.
Okay.
One of the laws that has been passed is recently in Virginia is allowing areas that are ready for such a and have high numbers of hepatitis C infections, hepatitis B infections, to see pilot a needle exchange program.
Okay, okay. Let's come home a little bit to Prince William County. Tell us a little bit about the linkage in terms of opiate abuse and maybe perhaps psychiatric issues and also some medical. You've described a lot about the medical, but tell us how it affects how is it related to other psychiatric conditions?
Well, Evelyn, I think that's a great question. And as I often put it, having a comorbid psychiatric illness with opioid abuse is almost the rule, not the exception.
Okay.
There have been studies which have linked or shown almost a 80% rate of co-occurrence of psychiatric illnesses along with opioid abuse. And I would say that this illness itself, besides the secrecy and shame, I think the illness often starts with pain, whether it's the physical pain or emotional pain or both,
Okay.
remains to be determined for that individual. But in my clinic, what we see is a high rate of prevalence of major depression, anxiety disorders, post-traumatic stress disorder or PTSD, and often attention deficit disorder in young adults. And then there's a smattering of just about everything else. But the point is, if you're going to comprehensively address it, you must treat both.
Okay, both at the same time.
Well, our goal is to treat the whole individual.
Okay.
And Dr. McLaughlin, isn't it true that some of the opioids, if somebody self-medicates, they with the opioids, it provides them some relief from some of these mental illnesses? Is that true?
Well, Dr. Ansher makes a great point. The brain undergoes a change after whether it's from the effects of primary psychiatric illness or comorbid substance use, opioid use in this case. And after a while, for some people, this becomes a remedy to treat themselves. And since for a while these drugs have been easy to access.
So would it be fair to say then that most people who get addicted, they get addicted as a result of using an opiate for another reason, for pain, like you said? Would that be fair to say that they don't start off, using opiates, abusing it? Most people?
I think you could say that with some conviction now that we have data and studies. For majority of people, it starts by nowadays starts by procuring a legitimate prescription from where it sort of gets out of hand, and then whether it's self-medicating, preventing withdrawal, or some element of recreational use. I think all of that gets morphed into this very complicated disease.
Yeah. Let's talk a little bit about treatment, because you alluded to that when you talked about the medication that people can get. Tell us a little bit about that.
I think, Dr. McLaughlin,
Okay.
you're probably
About
more
Narcan?
appropriate to talk about treatment.
Okay.
Well, I guess before we talk about the present-day treatments, it might help us to just kind of step back and look at how far we've come.
Okay.
In this country, up until 1914 or thereabouts, there was basically no law regulating any use of opioids. And in 1914, the country passed its first attempt to regulate drugs of abuse. It was called the Harrison Act, and it classified almost all prescribing or prescription medications into one of the 5 categories. And moving forward, in the 1970s, early 1970s, there was a doctor up in New York, Dr. Vincent Cole. He wrote a landmark paper which showed that the returning veterans who had become addicted to heroin could be helped with the use of methadone. And from there launched our first sort of fledgling attempts to treat this illness with medication and bring it out of the shadows into a medical forum where it could be addressed safely and properly. In the 1990s, there was a focus from various administrative agencies such as Joint Commission of making pain our 5th vital sign. Okay. And that along with some of the drugs that were available for pain treatment at that time led to perhaps some degree of overprescribing, some degree of mismanagement, and also perhaps lack of adequate information both for the prescribers and the consumers, which led to a pain pill overprescribing in this country. And now the disease, once those trends were recognized, then in 2000, this country passed a law called DATA, Drug Abuse Treatment and Addiction Act of year 2000. Okay. And in 2002, FDA legalized the use of buprenorphine, which has several different products, Suboxone being one of them, which could be given and prescribed in office-based settings, unlike the predecessors like methadone, which could only be prescribed for in specialized centers. So now we are very fortunate that we have various choices, but the history of treatment is not that old. So, we're learning as we go.
Okay. So tell us a little bit about some of the drugs that are used. I know there's some not controversy, but concerns that giving people medication to address the opiate use encourages them to use. Any thoughts about that?
I'm sure Dr. Ansher can speak to the public health consequences of this epidemic, but I feel mainstream medication, with very few exceptions now, subscribes to the theory of harm reduction. And harm reduction is this non-judgmental, non-coercive acknowledgement, in my opinion, of the fact that reducing the negative consequences of substance use has a positive outcome for not just the consumer but society as a whole. So I would say it behooves us to work on that principle.
But I think it's very important to mention it's not just giving medication, it's also giving behavioral health therapy that makes it most successful because of a lot of the reasons that people may start using opioids, as we've spoken about earlier, often have comorbidities. So again, seeing the whole person.
Yes. Okay. And let's talk a little bit about the program that's coming up that I mentioned at the beginning of the show. Can you tell us a little bit about what people can expect?
Well, I'm going to back up a little bit. The Prince William Health District facilitated a community health assessment, and it surveyed both providers and leaders in the community as well as community members to see what they thought were the 10 greatest public health issues that needed to be addressed. And substance abuse and mental health was in the top 3.
Yes.
And so from that, we broke into subgroups, and one of the subgroups is dealing with substance abuse and mental health. And we have determined some activities that we're going to do to educate the community, so the community is aware that we have an issue here too. It's not elsewhere. And so we have this program called Opioid Epidemic. Let's talk about it.
Okay.
Sort of to alleviate some of the stigma. And it's going to be, there's going to be vendors there that people, if they need to talk to vendors and get information because of personal needs, family needs, there'll be the health commissioner is the keynote speaker, is going to talk more broadly about the issue in the state of Virginia.
Okay.
We're going to have, we are going to show the film Chasing the Dragon, which was actually filmed in our adult detention center.
Here in Prince William
Here in
County.
Prince William. And so it is people from the community talking about it, being in the ADC because of opioids and in fact, a significant number of inmates are there secondarily to either opioid use or stealing or what have you to support their opioid use. And then there'll be an expert panel with all the agencies. We're bringing together Prince William County, Manassas City, and Manassas Park to show that we're working together on this very serious issue. To sort of answer questions that people from the audience are going to write down and expect answers.
Good. Okay.
And then, again, the vendors will be there. What we also plan on doing is, if all the questions don't get answered, we plan on putting together a frequently asked questions, and we'll be posting it on our a coalition's website that did the community health assessment, so that people can get answers to questions even that they may not have thought about.
That's interesting, because I suspect that people don't know what to do, what questions to ask, who to get information from.
And we're hoping that this
treatment.
event will stimulate people to start thinking and feeling more comfortable asking those questions so they can get the appropriate information.
Wonderful. I know we're coming down to the end of the show, but is there any last comments or information you think the community might want to know or be helpful for them to know, whether it's about the event or about opiate use in general?
Well, I would say, this is a disease often of secrecy and shame.
Okay.
But, we, through programs like this and the events that Dr. Ansher has just mentioned, we want to bring it out to the community that, there's help available. Please seek out help, and there are treatment choices which can be life-saving. So, let's get our medical, faith community, citizens, policymakers together, and I thank you for, what you all are doing.
Yeah.
And also, it's just one last point. It's very important to get unused medications disposed of appropriately. There are take-back events. One recently happened in April. Unfortunately, they don't happen often enough. But there's information from the FDA, if somebody goes on their website, that get very simple ways that people at home can dispose of medications. Because a lot of the teenagers, they have these pill parties, and they're getting medications from their home. And so here they start during high school or whatever, and then end up having a significant substance abuse problem as they become a young adult. So getting rid of unused medications, get them out of your house is so important. We even hear about people who go to houses that are for sale, not to really look at the house, but go into the medication cabinets and steal the medication. So as talking about harm reduction, and one of the simple things to do is just dispose of these medications that you're not going to use that could potentially be harmful to your family members or other
Right.
individuals.
Well, I'd like to thank you both for coming today because, as I've said in every show we've done on substance use, it's been so interesting. So, as a community, you've heard a lot of good information and resources, especially to go to the event on Thursday, June 8th. There's a lot of good information for you to get. And thank you so much for joining us. And have a good evening.